Have you ever had this burning pain in your upper abdomen that occurs between meals? Or have you ever had vomit that looks like old coffee grounds? If so, you might have a peptic ulcer, and that's exactly what we're going to talk about today. Welcome back to RN Info, the place where you get clear, reliable information on hot topics. Today, we're covering peptic ulcers. We'll go through what a peptic ulcer is, causes, symptoms, complications that may arise, diagnosis, and management and treatment. Stick around to the end as usual for some questions to see how much you've retained. Okay, let's dive right in. What is a peptic ulcer? A peptic ulcer is a sore or break in the lining of any part of the digestive tract that comes into contact with concentrated gastric juice. Thus, gastric juice is made up mostly of water, mucus, hydrochloric acid, enzymes, and electrolytes. The most common place for an ulcer to form is the duodenum, which is the first part of the small intestine. But ulcers can also develop in the lower esophagus or in the stomach. Now, moving on to causes. There are two main causes of peptic ulcers. The most common one is Helicobacter pylori, or H. pylori bacteria for short. Let's talk about how this works. The bacteria starts by weakening the protective mucus layer that coats the esophagus, stomach, or duodenum. Once that layer is weakened, acid can more easily reach the sensitive lining underneath. The combination of H. pylori and acid then irritates the lining further, allowing an ulcer to form. The other cause is non-steroidal anti-inflammatory drugs or NSAIDs. These include over-the-counter medications like aspirin, Advil, and naproxen. Frequent or long-term use of these medications increase the risk of developing an ulcer. Now, moving on to symptoms. The most common symptom of a peptic ulcer is a burning pain in the upper abdomen, usually felt between the breastbone and the navel. This pain can last anywhere from a few minutes to several hours and often occurs between meals. Eating food or taking an antacid may relieve the discomfort temporarily. Other symptoms include nausea and vomiting, weight loss, and loss of appetite. For complications, there are three main ones to watch for. First, bleeding. This may be the first and only symptom a patient notices. A bleeding ulcer can cause vomit that resembles coffee grounds or bowel movements that appear black. If the bleeding goes untreated, the patient may become anemic. Another complication is perforation. This happens when an ulcer is left untreated long enough that the gastric juices eat through the stomach or duodenal lining, creating a hole. This requires surgery to close the opening. The third is obstruction, which results from chronic inflammation caused by the ulcer. This leads to swelling and scarring that can block the outlet of the stomach and prevent food from passing through, thereby leading to vomiting and weight loss. Surgery is required to repair the obstruction. Now, for diagnosis and testing. How is peptic ulcer diagnosed? One diagnostic test is an upper GI series, which involves swallowing a liquid that contains barium, followed by x-rays. The barium makes the outline of the esophagus, stomach, and duodenum visible on the x-ray. Another diagnostic test is a gastroscopy, in which a provider inserts a tube with a camera and light that passes down through the esophagus and into the duodenum to look for ulcers and inflammation. A biopsy may be taken during the procedure. Then we have H. pylori testing to check for the bacteria that causes peptic ulcers. Several tests are available, including a breath test, a blood test for antibodies to the bacteria, or an examination of stomach biopsies taken during a gastroscopy. Okay, moving on to management and treatment. This involves lifestyle modifications and dietary restrictions such as quitting smoking and cutting out alcohol, as well as avoiding foods like chocolate, coffee, fatty foods, citrus fruits and juices, and pepper, since these can further irritate the ulcer. For medication, proton pump inhibitors or PPIs help protect the stomach lining by reducing acid production. Examples include pantoprazole and omeprazole, among others. If NSAIDs are the cause, they should be avoided going forward. However, if H. pylori is the cause, treatment usually involves a combination of one or more antibiotics such as amoxicillin, clarithromycin, tetracycline, or metronidazole to kill the bacteria. This is usually combined with a PPI. It's important to follow the treatment plan exactly as prescribed. Okay, that brings us to the end of the main content. Now, let's dive into some questions. Question 1. How does the bacterium H. pylori facilitate the development of a peptic ulcer? The answer is, it weakens the protective mucus layer of the digestive tract. Question 2. A patient notices their vomit resembles coffee grounds. Which complication of peptic ulcer does this likely indicate? The answer is bleeding. And lastly, which medication type is used to protect the lining of the stomach by decreasing the amount of acid produced? The answer is proton pump inhibitors. Okay, that brings us to the end of today's video. If you found this helpful, please like and subscribe, and I will see you in the next one.